word to Professor Ljubic, please.
Okay, thank you, Professor Rakic, Dr. Abazovic. I'm going also to try to share the screen and then to introduce you, but probably before I start sharing screen, what I would like is to thank Professor Rakic, because when he asked me several months ago about, or maybe half a year ago, about the organization of this meeting, I accepted, and when we heard again 10 days ago or 2 weeks ago to choose the participants, he actually changed my way of thinking, because this was the first time I really went deeply into the bioethics by reading all the stuff about that, and it is going probably to influence my way of working, organizing, and working with patients. And I'm sure that probably the greatest effect of this conference is actually in gathering different people doing the actual job. If we are discussing the enhancement of human being, then the medicine is really important part of it, and this part is concerning biological and biotechnological approaches to human medicine. And I do feel a little different with a different view on the things that have been done until now. And what I miss, and maybe in some other meetings, I would like to have the users of the enhancement or of the biotech as the cooperating part of this kind of conferences. So what I'm going to continue now is to discuss my point or the field that I'm doing. I do hope that you all have the screen and with bioethics in longevity and reproductive medicine. Do you see my screen? Just approval, Jihan?
No.
No.
Currently, no.
Sorry, then I'm going to repeat it again. No.
Now we see.
Okay. Then, and I would, before that, like to thank all the participants for a short notice for this kind of thinking and discussing with very esteemed colleagues. But we are people doing the job. And I do think that having the connection with the others who are really deeply into the ethics, bioethics, for different point of view, it's very useful for us and at the end for our patients. So these are two parts of my speech that I'm going to address. One is anti-aging of longevity, and the other is reproductive medicine. This reflects my area of work, because for the last 10 years, it is also longevity added to the reproductive medicine that I was previously deeply into this. For the first part of this interchangeable words, longevity or anti-aging treatment, there are different dilemmas before we discuss, and I'm not going to discuss what can we do or what we are going to be able to do, but primarily whether we should do it, how should we organize it, how should we control it, how should we think of it. So the first dilemma is actually whether it is completely normal and natural process, which is the aging is considered for as long as the mankind exists, like normal, natural process. But it is also the organismal senescence and a disease in which we have broad spectrum of very different pathological consequences and the things that we can influence on if we consider aging to be a disease process. So our first dilemma is whether we are treating normal situation or whether we are treating some pathology that could and should be treated. There are a lot of work being done for the last long time, centuries, but for the last decades, it is very intensive, trying to see what morphological cellular changes is happening, what DNA damage, what mitochondrial damage, what are the other cellular or subcellular substrate for aging. So we do know a lot about that. Whether it is normal to thrive to correct it and to try to do something about all this knowledge that we have gathered, I am going to discuss with this picture of Prometheus, or one of the titans who brought us the light and who had the eagle eating his liver, which was regenerated during the night. So it is not only a symbol of light, but of science and of regenerative medicine, and it is some kind of star blinking for me that it could be possible to regenerate the tissues, the organs, or maybe the whole organism. So today I'm going to discuss something about the research, the stem cells, the regeneration, the cryobanking, or the different approaches to longevity and to anti-aging treatment, which at the end is in the completely opposite spectrum of life as the reproductive medicine, which analyzes life even before it starts, before the embryo is formed, by analyzing the oocyte and the semen, and then at the other end, the regeneration in the anti-aging longevity medicine. So there are various spectrum of the things that we are doing. I'm going just to mention some of them, but it is now mainly on subcellular, on nuclear, and on cellular level, the things that we are trying to do to obtain a longer and a better quality of life. But before that, what is bioethics of longevity? And I found some kind of definition. We can obviously argue about this and discuss what could be the definition, but it is definitely a set of moral criteria, of some normative recommendations, of some principles and some rules in the field of research, development, and application of medical treatments that we do in order to try to ameliorate degenerative aging processes and try to extend healthy longevity. So this could be some of the definitions. What is the role of bioethics in the field of longevity medicine? And we do have a lot of research and a lot of development of new anti-aging therapies, but the reason that we do not have strict position of these therapies in the field of anti-aging treatment is that they are missing evidence-based criteria, both for the efficacy and primarily for the efficacy, but also as well as on safety. The other thing in bioethics of anti-aging is that in application of the potential treatment for anti-aging, there is a difference in choosing the target patient populations. And there is also a very big problem because of, at the moment, price of these therapies in distribution of them, in the equality and equity, in social and individual implications of really widespread anti-aging treatment, as well as the identity, the meaning, and the allocation of the resources for this kind of treatment or this kind of health treatment, not just medical treatment. Aging is a big medical problem, and we do have, I repeat it, problem in assessing the safety and efficiency of these procedures. There are very, very, very few really solid-based clinical stadiums. They last for a very long time. They have their not only ethical but structural problems that makes this kind of clinical research very, very difficult to punctually interpret. Then there are moral issues on the clinical trials on the elderly subjects. Then there is the issue of the multimorbidity that these subjects already do have. There is selection bias, and there is socio-economic factors influencing this kind of research. Then when we compare applying these procedures on a younger subject, not the ones that are already aged, we do have different reactions of different treatments. We do have expected benefit in older age, which is to be proved. And the problem of the clinical trials and the ethics of the anti-aging clinical trials is whether we are able to eliminate every variable that influence the conclusions that we get from these trials, because there is enormous variety of the different influences on the variables that we are trying to measure in those clinical trials. So it is very, very hard to make a conception of such a study that would fulfill all the criteria. Then there are other problems. I'm going to address only two of them more with longevity treatment, is the antagonistic pleiotropy, or the benefits for the young at the expense of long-term deterioration for the old, and vice versa also. Then another thing very important for all society is that anti-aging treatment may be very beneficial for an individual, but it completely changes the setup of the society. It could be disastrous for society because the influence on the number of the aged population with the old demands, very specific one that aged people do have. So what we have to try to conclude that we need to have adequate bioethics of the research, development, and application of the possible therapies, that it must be very broadly discussed and elaborated, not only by the people doing the therapy, but also in academic setting, in policymakers, as well as the general public. And we do need to improve health and research policy for the rapidly aging population, because the world is rapidly aging. Second part of my talk is the opposite side of the timeline, or the reproductive medicine, or the problems before the life starts. So infertility or sterility is a major public health issue with very devastating consequences for both the affected couple and the whole family. We also know that good control of the human pre-implantation development affect the treatment, and that we are now going to the very, very advanced kind of therapies, biological therapies in this field of reproductive medicine. I'm going to discuss several parts. The first one, I'm going to give just one slide because Dr. Abazovic is going to discuss genetics, but it's probably the most important and the main one because somatic and reproductive genetic treatment are completely different, and the whole world was shocked when we had Dr. He announcing the twins, so Lulu and Nana, which had the genetic editing and some kind of really applied genetic therapy for the human beings, and having this kind of genetic modified DNA continuing in all their lines. So this is going to be discussed by Dr. Abazovic. We do have very strong ethical dilemmas, which are not just theoretical, they are, for us doing the job, practical and almost everyday business, because the old and the very rapidly growing advances in biotechnology and reproductive medicine brought us the problems with the cryopreservation of both gamete and embryos, brought us the rights of the embryo, brought us the policy of gamete and embryo donation, the surrogacy, and very important in regenerative medicine, biobanking, especially for reproductive medicine, biobanking of reproductive tissue. I'm going to start first with freezing or with cryopreservation of reproductive material. So there are different dilemmas which are not only medical but ethical as well. Should there be an age limit for both fertility preservation and fertility treatment? What are the safety concerns? Are they very well established? What is the ownership problem? What happens if the patient dies? Is there any right for the remaining partner to use those biological material for reproduction? What happens if the couple divorce? Who decides the fate of the embryo? What happens if the couple doesn't agree about the destiny of the embryos? Is there any regulation or any thoughts about the posthumous use of gametes and embryos? It is also not very often, but the things that we are occasionally getting onto that. What is with the loss of the gametes and embryos that do not survive? There is specific approach to that. What is with abandoned reproductive material, which is also things happening in the everyday working practice. Now, a little about the embryo selection, and we do have very developed technological ways going from the time lapse. You can see here monitoring of the first division of the fertilized egg, and you can see on the right side of the screen the biopsy of the trophoectoderm of the blastocyst with the idea of genetic analysis of this biopsy. So we do have very, very sophisticated technologies to select and to influence the embryo. We also have very highly developed technology for biological fetal therapy. So we are treating fetuses already in the utero. There are very big dilemmas for that, because sometimes this disease can, I'm sorry, just want to finish here. This disease of the treating of the disease of the embryo can jeopardize the mother, and how serious should be the disease to try to make the remedy in utero. How do we decide whose rights are the primary one, and how do we measure these very different risks? Then the moral status of the embryo. Is it a person, a proto-person, a person in becoming? Whether we do have right without contents to do the PGT of the embryo. Then what is the serious illness? Because it's a great variety of the acceptance of the illness in different cultures. Is it allowed to distract the non-affected embryos? Could they be abused for non-medical reasons? How accurate is our technology? Because for years we are believing in some kind of, for example, pre-implantation diagnosis and getting the chromosomal status of the embryo, and then implanting only one type, not implanting the other type. And they have then they have the new knowledge that this was not such a precise diagnosis, and that we actually could have had some very healthy people born from the embryos that we destroyed because of our knowledge in that time. So with limited knowledge it is, and human knowledge is always limited, it is a very tricky question, what can we really do and what we are allowed or should be allowed to do. Then another problem or aspect, moral aspect of the donation, it is not completely the same as donation of the organs in the other field of medicine, and it has very specific implication for the donors and for the recipients. It has medical and psychosocial indication for donation. We have the dilemmas of autonomy and privacy of the parents, privacy of the donor, and on the opposite side, the right of the child to know its parents. And then what happens to surrogacy, which is now in some cultures very, very often think, and having this changed sex, men and female relations, we more often have the surrogacy as a way to have the same-sex parents on one side and children on the other side. So in surrogacy, is there commercialization and exploitation of the women? Do we respect autonomy? To what extent the parents can control the lifestyle of the surrogate mother? What happens with the termination of the surrogate pregnancy if there is something wrong with the fetus? What happens with the fetal therapy in utero, because it is the surrogate mother that is going to suffer the possible consequences, not the biological one? Should the husband of the surrogate mother give his informed consent as well? What happens with bonding in that case? And I'm going to go to the end of my part of this session with the discussion of the biobanks, or a pretty important institution, or the way in medicine in which we have a biorepository of the biological samples associated with the informations on these samples and on the donors of the samples for the research and therapeutic purposes. So there are a lot of ethical and legal issues in biobanking, and I'm going to just mention some of them. What kind of consent should be given for the long cryopreserved tissue? What is data protection issue? How can we use it secondary to store tissues? What is about the commercialization both of the tissues and on the information of these tissues? And what are the stigmatization and genetic discrimination? Those consents are very seldom blanket consent for everything, and they should be probably separated to recruitment, to be involved in particular study, for future studies, maybe genetic or some industry studies. Would it be contracted to the future studies? Could donor decline participation, and in what way if it is in 10 or 20 years after giving the sample? Then the data protection, ability to trace back the identity of the donor, and this means that samples are not anonymous, and then secondary use or ability to use the tissues for research not anticipated in the time the tissue was harvested. Then the commercialization of this biological tissue, which should apply and strictly adhere to the principles, because donations of human tissue must be free. And then the stigmatization and genetic discrimination because of person's genetic background, it can give unequal treatment for this person. So to conclude my thoughts about the bioethics in longevity and reproduction, the modern science and modern technologies, they expand our horizons and our possibilities. Many of the ethical and moral dilemmas are still waiting to be resolved, if they can be resolved at all. I thank you for the attention.